Hussein. I'm one of the psychiatric registrars in Oxford, south of England. And I work in Littlemore Hospital, which is a medium secure forensic unit. That's a psychiatric hospital for people with mentally ill offenders. So the aim of, thank you very much for inviting me to this conference, and it was really a very nice conference, a very nice city. So the study is about the use of Z hypnotics, which is the new hypnotics, the zopiclone, zolpidem, and zalpidem in the management of insomnia in Littlemore Hospital in psychiatric unit. And the authors, I did that study with two of my colleagues, my supervisor, Dr. Kosla, and Dr. Thapar, who is a specialist registrar in psychiatry. And the aim of the study was to review the newer medications. These hypnotics were prescribed according to the NICE guidelines, which is the National Institute of Health and Excellence in England, and if we were following these guidelines or not. And the methodology, we reviewed the drug chart and the clinical notes of the 74 patients who were admitted to Littlemore Hospital in Oxford in 2010, between January and June 2010. And the domain of the audit was taken mainly from the NICE guidance and included the following items. So we were looking if the diagnosis or the symptom of insomnia was documented in the clinical notes, and if other measures, the sleep hygiene measures, were the non-pharmacological treatment of insomnia were tried before prescribing the hypnotics or not, and documenting the reason for switching the antidepressant, if there was any switching, switching the hypnotics if applicable. And one of the NICE guidelines says that the hypnotics should be prescribed in the PRN, which is the as-needed section of the drug chart. So they shouldn't be used on a regular basis. So when the patient needs them and he cannot or she cannot sleep, we can give them as needed basis, so not on daily basis. And they should be used for a maximum period of 2 weeks, maximum 4 weeks duration. So we try to see whether the maximum duration was recorded or not. And the sixth point was that, is there a review date for the prescription? So discussion of the findings, we found only 3 prescriptions for only 3 patients out of the 74 patients, which was around 4%, who were prescribed zopiclone. And one of them didn't use the zopiclone. It was just written on the drug chart. And the 2 other people used that for only 2 to 3 days. And we didn't find any other prescriptions for zolpidem or zalpidem. So the conclusions of this brief study was that insomnia as a symptom was documented only in the drug chart and occasionally in the nursing notes, in the nursing clinical notes, so not in the medical notes. And the sleep hygiene measure was offered only in 1 case. What we mean by sleep hygiene is trying the non-pharmacological ways of treating insomnia, like listening to music, reading a book, having a hot bath, and avoiding caffeinated drinks after 6 o'clock. And there was no switching to other hypnotics. So the only hypnotic was used, it was the zopiclone. And they were all 3 prescriptions were put on the PRN, on the as-needed portion of the drug chart. And the maximum duration of the treatment wasn't documented as well, so that didn't go with the NICE guidelines. And the review date wasn't documented as well, so it was left open. So as I said, it should be between 2 to 4 weeks. So I think a vital point in this study was that the documentation related to the prescription of the Z hypnotics is a vital issue, and it was seen only in the nursing notes of the 3 patients, so it wasn't seen in the medical notes, unfortunately. And the aim of we're trying to re-audit that. We've implemented some new changes to the services so that these things should be implemented. So, as I said, the conclusion, the hypnotics are rarely used in forensic units in Oxford, and they were used only for a few days, and the Zopiclone was the main hypnotic used, and there was no switching to other hypnotics. And the documentation of the hypnotic prescription didn't meet the standards set by the NICE guidelines. And the recommendation and the actions plans of this study was that first of all, we should try the non-pharmacological ways of treating insomnia, so by trying the sleep hygiene measures, as I said, by listening to music, hot bath, and just try some relaxation before sleep. And documentation should be done both in the clinical, in the nursing, and the medical notes when the hypnotic was prescribed and why it was given and where the sleep hygiene measures were offered or not. And the maximum duration should be written clearly, so between 2 to 4 weeks, preferably 2 weeks. And the plan is to complete the audit cycle by doing the re-audit, and we are in the process of doing that now. And acknowledgement, thanks a lot for all of you and for all the attendees, and definitely to all the staff at Oxford Health who helped us in this audit. Thank you very much.